and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com. By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Breathe clean filtered air with an Air Tamer Personal Air Purifier. It's easy to have filtered air with an Air Tamer Personal Air Purifier. An Air Tamer Personal Air Purifier emits healthy negative ions to push airborne pollutants away from your breathing space. It's purified air wherever you go. The Air Tamer Personal Air Purifier reduces viruses by 99% within 20 minutes. Go to drtomroselle.com/products to get an Air Tamer Personal Air Purifier. For a limited time, use the coupon code Roselle and get a 20% discount and free shipping. Order today.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Are you suffering from flu-like symptoms? Get relief from muscle and body aches, headache, chills and fever, cough and congestion with Oleander 4X. Oleander 4X, made from oleander extract, is a tincture that provides relief for flu-like symptoms. Get relief with Oleander 4X. Go to drtomroselle.com/products to get Oleander 4X today. For a limited time, use the coupon code Ageless Health and get a 10% discount. Order today.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hi, everybody. Dr. Tom Roselle here. Welcome to Ageless Health live stream. And we have another interesting program for you today. I say interesting because it's something that all of us need to know a whole lot more about. And what I'm talking about is facial representations of cardiovascular problems. And I want you to know what to identify within yourself. I want you to know what you need to do if you see something, and not panic if, by the way, it's something other than a cardiovascular problem. So over the last couple, 2-3 weeks, we've been talking about heart disease and blood pressure problems and low blood pressure. I'm going to talk a little bit more about that today. But I want you to really get and understand that your face is a tell. That means it often represents what's really going on in your body. And this situation is no different than that. If you look at your facial configuration, you're going to see if you're really tired and allergies are out there, particularly right now, this is the springtime, your face is going to be puffy and you might get a little darkness and through this area here. And those areas indicate very specific possible potential problems within your body. Now, but there's other pieces of the puzzle too that you really have to be aware of. And we're going to talk about those today as it reflects your cardiovascular health, blood pressure problems, and so forth. And what I want to start with is I want to answer the question on low blood pressure. And somebody, has blood pressure around their toenails, which is, depends on the age. That's how you make the determination. But let's say an adult, you're over the age of about 16 to 18 years old and your blood pressure is low. What do we consider low? If you're in my neck of the woods, age-wise, and your blood pressure is like 100 to 102, that's not okay. It's too low. It doesn't give me what I need to do to push that blood through the system and so forth, unless I'm an extraordinarily trained athlete. And, I'm looking at then potentially that, but most of us who are not in that arena, that we're not pushing every day, we're not, taking ourselves to the limit, our blood pressure shouldn't be that low. So, but if we start seeing a drop, so what are the indicators? What are the suggestive patterns that might mean that we got a problem? So you're sitting down and you get up and you get not only dizzy, but you get a little disorientation. That suggestive that your blood pressure might be dropping. And that has to do with a couple things. It has to do with the vestibular area at the base of your brain, but it also has to do with these little glands, as we've talked about many times, that sits on your adrenal system, or sits on your kidney. They're called the adrenal glands. And they put out hormones, one of which is angiotensin, which puts a little tone in the vascular bed, the arteries. And if that tone's not there, when you get up and you change postural patterns very quickly, the blood drops fast. It's not stabilized. And that all by itself will give you that dizzy feeling. That disorientation feeling, again, that's not normal. So is it problematic when it comes to your heart? Possibly. It depends on the other factors that are surrounding it. And when I say possibly, I mean this. Do you have other indicators of swelling, perhaps in your feet? The ankles aren't returning the blood supply the way it should. That's what causes that congestion. Is there shortness of breath, if you will? And if there is, you need to look at those pieces of the puzzle as well. So you start putting the things together, and we're going to talk about several of those today. Then that low blood pressure could be a problem. It could be that there's not enough energy in the heart muscle, and that's your ATP, that's your energy pack, adenosine triphosphate, and it feeds the fuel, if you will, and it keeps things moving the way it's supposed to and keeps that heart working normally. So we have to put the pieces together. And so what's the biggest danger of low blood pressure? Well, it can be that you go into heart failure. Now, would you have things that would begin to suggest that early on? Yes, if you weren't paying attention to it, or you say, "Oh, it's nothing; it'll go away," rust up like a bad pipe. Uh, yeah, it could be an issue. So we would look at our feet. Is there any cyanosis? Means bluing of the nails, either in your hands, your fingertips. Is there any bluing in your toes? Is there any swelling in your feet? Is there swelling in areas? Do you have a belly around you, the midsection? The rest of you is kind of thin, but the belly is there. That is not a good cardiovascular sign. It's just not. And you have to make sure that you start putting the pieces of the puzzle together. But I'll get back to that a little bit as we go through the program. But I promise I'd begin at least be suggestive to that, and we'll talk about some of the things that will, put the fire out, if you will. In today's world, when I see a patient in the practice, or they reach out and they ask me, I have a problem, I'm getting some what's called intimal thickening. And that's, if you look at the blood vessel itself, the artery, okay, and we have a cross section like this, intima is this area in through here. And so we have to ask the question about that. But it means there's some narrowing. It doesn't mean there's plaquing. It just means that there's thickening. And if that thickening exists, if they've done the right testing, maybe an angiogram, maybe some transcutaneous ultrasounds, something that would give us more evidence. We did the right blood work, which we talked about early in my radio program on Dr. Tom Roselle Live today. And we talked about the different markers that you have to make sure that you assess properly to see if there's an inflammatory reaction that's getting into the tissue, it's thickening it up, it's making it swollen. Now, what I want to leave you with is the idea that you have to identify these things to be able to save sometimes your life, and also to know that they are reversible. But you have to know what you're trying to reverse. You have to know what your body's doing. So reversibility has a lot to do with what you can identify as going on. You don't have to take a drug, unless you're in a terminal thing and you want to save your life at that moment in time. But the body is extremely forgiving, providing you provide it with the platform it needs to have to resolve issues. So how do we do that? How do we assess that? How do we know? First, let's identify some problems. Now, you've heard me talk about, I want to get a little bit more in depth on that, something called frank lines. And there was a doc that discovered these back in the 70s, early 70s. And what we're talking about is the earlobe. So if you see these deep lines in the earlobes on either side, sometimes both, or kind of a diagonal line like this, that indicates more so than not that there's a cardiovascular problem. And you can't kind of just shun that off. It's not genetic. You may have a genetic predisposition to cardiovascular disease, but frank lines often suggest, more often than not, and I'll put myself out there and say all the time, that there's a cardiovascular problem that's starting plaquing, inflammatory reactions, and so forth. Don't ignore that. You have to make sure you see it. And then you're going to do the right testing so you can see what was done. Now, we talked about it in the radio program today. We talked about triglycerides, and we talked about LDLs and HDLs and total cholesterols and so forth. But I said, that's not all you need to know. You need to know about the breakdown, the apolipoproteins, big A, your LDLs, there's a big A, there's a small A. Small A is very indicative of clotting. You have your apolipoprotein B, which is also a clotting indicator. So you have little a's, which are not good to have, and you have these B's that if they're up there, you're clotting. You have to know different blood sugar levels to see if there's inflammatory reactions. You have to run coronary C-reactive proteins. You have to do some other neuropeptide measurements to see if there's any damage. So that's how you do a full cardiac exam. And it's not just doing 3 tests or 4 tests. You have to put things together. And if you drop these cholesterol levels way too low, guess what happens? You get sick. you begin to lose hormone function. You begin to lose mental cognition. You begin to have muscle aching and cramping. You get to have other clotting taking place that you're not even aware of. And say, oh my gosh, he was in great health, except he dropped dead. So let's talk about these indicators that gives you a heads up of doing the right thing very quickly. Okay. So when you look at somebody's face, take a look here, the sides of their noses. Those little spider web veins that you get in here, they're not supposed to be there. Your nose is supposed to be pretty clear. There's suggestions that they could be due to liver problems. But what we see is anytime you see those little pinpoint spider areas that kind of break off any place, those are suggested that the blood supply is not doing what it's supposed to be doing. And if the endpoint there is not expressive the way it should be, if it's not clear and so forth, that tells you that you may be developing a cardiac problem. Those little small little red things that we talk about, you usually have them on your thorax, and we say they're liver problems. Well, yeah, but the liver has a lot to do with the heart, and the blood supply having been compromised in that area is going to be compromised in other areas as well. So we're finger pointing. So you have those things. You begin to see those creases in your earlobes. You begin to see these little spider web formations in different parts of your body, regardless of where you see them. If you see that your ankles have not just varicose veins in your ankles, but that heavy bluing at the bottom, that's a vascular situation, and you've got to spend a little time trying to figure out what you can do about that. In May, we're going to be doing an in-house program on cardiac function, high blood pressure, and so forth. I'd love to have you join us, because I'm going to show you pictorial representations of the things that we're talking about today. If you're in the Washington area, in the Fairfax, Virginia area, join us. Just give the office a call at 703-698-7117 and join us for that presentation. I think that you're really going to get a lot out of it. And guess what? It may save your life. It may really resolve the problem, that you've been putting up with. But on the 15th Wednesday of May, we're going to gather. And remember, we have limited spacing. So if you'd like to make that happen, make sure you register for it so we can prepare for you adequately. It's important that you become your own primary care doctor. It truly is. It's important that you have the diagnostic signs. So let's go on a little bit. Let's talk a little bit more about those pieces. So we talked about the vertical lines in the earlobes. We talked about the little spider veins that can break out. We talked about, particularly you see them in through here. Those are suggestive of a problem. We're not going to name it, but it's a problem. Take a look at the tip of the tongue. If it's red as compared to everything else, a little brilliant red, that tells you that you got cardiac stress. Heart's being challenged a lot. And you have to take that indicator as well. So how do we proceed? First, we have to know what we're looking at. We have the ears, we have those spider veins, we have the liver signs, we got these little spider veins, we have swelling in the ankles. And then the other piece is bluishness of the nail beds. If you press your hand like this, you're on your fingers, you just tighten it up and you let it go. First, it should express it and make it rapidly. And it should have a nice reddish color to it when it fills back up. If that's not it, you got a blood supply problem. You could also be anemic because of that blood supply problem. And we want to make sure that we start tying the pieces together. Now, I don't want you to be a hypochondriac. That's not the whole idea of this presentation. But I want you to understand that when you have more than one or two of these indicators, particularly the ears, particularly these little spider veins, particularly the swelling in the feet or the ankles, something is not working the way it's supposed to, and it's putting pressure on the heart. If you've had a vaccine, if you had any of the COVID vaccines, if you had the Pfizer, Moderna, J&J, any of them, we know that you run a risk of increased cardiovascular something. We know that there's clotting that's taking place today that we've never seen before, never before COVID, and they can't identify what the clots are. They've never seen them. So that doesn't suggest that we can't do something about it, because we've been treating a lot of patients with cardiovascular long haul and having to reset their nervous system and having to make sure that they do things very incrementally. And there's a whole process of evaluation. There's no cookbook. It depends on you, your background, what other things are going on with you, and so forth. You have to make sure that you identify the why is that, the underlying problem. But if we go to these frank lines and we go to the punctate areas with the little spider webs outside of them, then we look at the eyes, right? Now, there's a suggestion that the halo that some people get on the outside of the iris, the colored part of the eye, is called arcus senilis. Big term, simply means the arc of old age. And it used to indicate that there was cardiovascular impairment, or particularly cerebral impairment. And is that the case? Perhaps it's possible, particularly when you tie it into other markers. But again, can you resolve it? Can you change it? If you look up in the traditional literature, they're going to say that those arcus senilis, round, circular, they look like plastic, if you will, that has been put on the edge of the eye. They're suggestive with other pieces of the puzzle. Can you reverse things? You can reverse anything. That's my opinion, providing you put yourself in a platform that the body is allowed to restore its function. But, you know, the biggest problem that we have in healthcare is us. We get in the way. We're the ones that don't do what we're supposed to be doing. You know, when you think about our environment, you think about foods today. Do you realize that unless it's organic foods and can be certified organic, Europe won't take most of our stuff? They won't take our meats because of the way we raise them. So if they're outlawing things there because they know our stuff is garbage, why we put it in our own bodies? Why are we doing that to ourselves? In Eastern medicine, we know that the liver is tied into the heart. It's tied into other functional capacities in the body. So if we're polluting it because we're drinking, we're doing drugs, we're eating the wrong things, we have all the environmental crap that's around us, and that's got to be filtered through that. We're drinking fluoridated water. We're absorbing chlorines into our system, which we've known for years, decades, that both of those substances, particularly fluorides, can cause cardiovascular problems. If we've had heavy metals of some sort, some source going into our system, we know those can cause an issue as well. So it comes down to, how do you put that together in a way and start finger pointing and say, I got a problem here and I need to do something about it. Well, yeah, you do. You got to do something about it, because you're going to end up with an unfortunate side effect. Sometimes it's called death or impairment, where you can't have your life anymore, or your joint spaces can't get the circulatory pattern that they need, and other systems begin to break down. But you have to have the ability and the information to identify what is really going on for you. So we start with, let's look at those earlobes. Do we have frank lines? You know, you can see mine, I don't have any, right? I got some skin dragging, but nothing in the earlobes. And, you know, I'm at that place where a lot of guys, you know, my age, a lot of people my age have those signs and symptoms. Now, I wasn't vaxxed. That's just me. I haven't had anything in my body since I was in PLC program at Quantico, Virginia, United States Marine Corps, when I was in college. And God knows what they put in my body then, but I did take the time to make sure that I cleared my system. Again, personal choice, and everybody should have personal medical freedom and to be able to decide what you want to do. But take a look at your own system. You know, how many fillings did you have in your mouth that were the old-fashioned mercury fillings? The silver, you know, the mercury that was in them, and that impairs all kinds of problems in the system. How many of you live in areas of water reclamation? What does that mean? Well, if you live in the Washington, D.C. area, inside the Beltway, Route 495, most of the houses of the old houses were built with lead piping. And that's one thing. So you're getting leakage of lead, soldering of other pipes with lead, and it gets into the water system. That's number one. Number two, it's a water reclamation. That means that they reclaim wastewater and recirculate it back into your drinking water. So if we're on hormone replacement, particularly estrogens, lady, I'm sorry, and birth control pills are loaded with that. If you're getting these hormones, you don't use them all. Use maybe about 20%, and then you urinate out the rest of them. It goes into the water system. And then it goes to this reclamation area, and they clean it up, and there's so many parts per million. But the one thing that they can't get out completely are hormones. So they put it back in the water system, and we begin to reabsorb this stuff. And now we're seeing increase all kinds of problems, cardiovascular disease, but particularly cancers. But in the cardiovascular arena, guys, guess what? You get to drink that stuff. And then you're getting man boobs, and you're getting all kinds of stuff, right? And your libido's going down your toilet because of a lot of things. If your testosterone level drops too low, you increase your risk of cardiovascular disease. If it gets way, way, way too high, you increase your risk of cardiovascular disease. So you have to get into that sweet spot and understand that you are responsible to ask the right questions. And this stuff's not hard. You just pick, figure it out. I don't expect you to be biochemists, but I expect you to understand that, in fact, that there is signaling that occurs from the body to give you a what's up, and not just a textbook or an AI computer that is judging you based on the information that of the Q&A of the guy that's putting the information in. Remember, artificial intelligence is only as good as a query. And you come up with all these possibilities, and then your doc still says, here, we're going to give you this drug, take this and call me in the morning and see what's going on. I don't know about you, but that's not enough for me. This is a functioning being, and I know they want to kind of eliminate us at some point. I know, I said that. That's not okay. I did say that. But until that happens, I think you need to optimize what's going on with your body. You need to know what the signals are relative to the expression of cardiovascular health. So we're going to take blood pressures. Now, is a blood pressure of 135, 138 over 83, 84 a problem? Not necessarily. If I walk into a physician's office, it's like the last place in the world I want to be. And my blood pressure generally runs about somewhere bounces between 118 over 72 to 124 over 74. But I go in that office, I promise you my blood pressure is going through the ceiling because I don't want to be there. You would think that I could calm myself down knowing what I know. Well, the problem is I know what I know, and that's why my blood pressure goes up. And I don't want to have to get in an argument with anybody. And I want you have to get into an argument with somebody and be told what to do. I want you to be able to evaluate it. And I want you to ask questions like this in your brain. Does that make sense? But I don't see anything that indicates that. Now you got to look. You have to look at your eyes. Are your eyes red? The sclera, the outside white of your eye, is it red? You have these little ruptures of arteries in your eyes. That's called ocular pressure. It could be because your cranial plates, you got 22 of them, are locked. So they're not moving spinal fluid the way they're supposed to. That can cause an increase in blood pressure, which increases your risk on your heart, which ultimately will give you the Frank lines. It will give you these little ruptures of the small arterial beds. All of those guys kind of stack on each other. So wouldn't it be nice to know what you're looking at? Now, so we have all these pieces. We have the little red areas on our chest and our abdomen and our back sometimes. And, we call those, liver spots. That's impaired circulation. And either it's superficial, hopefully, but when you get patterns in one side or the other, that tells you something else. You look at your feet and you say, oh, my feet are swollen today. Well, really? Are they swollen today or have they been swollen? Are they swollen in the feet or are they swollen above the feet? We talked, I think the last program I talked to you about the second heart. And I said there's a muscle called the soleus muscle. and it sits underneath the calf muscle, the gastrocnemius. There's two of them there that make up your calf. Gastroc on top, soleus in the bottom. So why is it called the second heart? Because it pumps blood back to the heart, or actually to the lungs, for reoxygenation. But if it's not working, you get the stagnation. You get the swelling in the ankles. And you grab a hold of your calf muscles and they hurt. Your feet swell because you can't return the blood flow all the way up. You have to know the signs and the considerations. You have to know what's really going on if you're going to make a difference in your health. And it's up to you. It's not up to your doctors. Listen, let me tell you where it's going, right? Hospitals, as we know them, are going to be the thing of the past as time goes on. Why would I say that to you? Also, your GPs and your internists and your nurse practitioners are going to be the vetting institution. But why would I say that to you? With artificial intelligence, they're going to start implanting. I did an article this morning, and I was sending it out. I was doing it on this topic, but I was also referencing some things. And there was a presentation where they're going to put a tattoo that is going to have microfilaments in the wrist. And I think it's going to be on this side, and that they're going to be able to monitor and identify any problem situation. They're going to hook you into the cloud. Really? Think about that for a second. Now, is this somebody's hallucination that I was listening to? This was a scientist that was proposing it, that they're already doing it, and that they're going to propose that this be done across the board. And she was so glib about it. She says, "Yeah, kids will do this, just to piss off their parents. They're going to put the tattoo in." Really? I don't know about you guys, but that's kind of a heads up. That's a warning signal that you better do something about this. You better take control of your own health. You really need to understand what's going on. And if you can't do that, you're going to be told what to do, when to do it, how to do it, until they don't need us. Well, that's a different story. But you really have to get it together and become your own advocate, because nobody else is going to do it for you. Nobody is going to make it happen. This problem that we're having now post-COVID and post-vaccine, I told you before that one of the things that we know is the vaccines activated underlying viral conditions. And those viral conditions now are getting into many structures. The heart is one of them. And we're seeing cardiovascular impairment that is coming about because of that. That's a lot of where this clotting factors are coming from and so forth. So you need to read, and don't take these things lightly. Don't listen to the talking heads per se. If you listen to the talking heads, you're going to be in trouble. Because, as I tell my staff, I tell my wife, I tell my family that there are two lies that are going on, regardless of who you listen to. They're direct lies and manipulation of all kinds of data information. And then there are lies of omission. They're not telling you everything. They're just telling you what they want you to know. It's the truth, nothing but the truth, so help me God, right? Something like that. The old-fashioned, actually, ethics and integrity on the platform. So if I'm right, then you really need to be your own observer, your own advocate. You need to make sure you know what's going on. You have to be able to recognize what's taking place. When you look in the mirror in the morning, don't look at there's a sleepy creature there, and you start asking questions. What's this all about? What's this long, deep line that's in my earlobe? That wasn't there 6 months ago. What's this little right in through here? What's these little spider veins that come out like that? That wasn't there. Am I taking something different? Am I on medications that were designed to do something, and they didn't do it because they have all these other side effects and they're compounded on other things? Is the tip of my tongue brilliantine red? I must have some stress someplace. Well, that stress is hidden in your heart. Are your lips cyanotic? Are your fingertips pale? Are your ankles swollen? Do you have the liver spots? They all suggest a problem. And to ignore it, to see if it's going to rust up and go away, or let your doctor say, why don't you take this and we'll take this and we'll see if we can calm it down. And we got to get your blood pressure down. No. If you're like me, you went in his office or her office and you just, you're all jacked up and nervous and so forth. Somebody comes into my office, I never, ever, ever judge their blood pressure unless it's really critical, it's way high, on one visit. What I do is I tell them go home and I say, I want you to take it every day at the same time and write it down at home. And let's see what it is over a period of 2 weeks. We jump at conclusions that are unnecessary because what? They get writer's cramp. They want to give you a drug. But you have the key. The key is you and identifying what's going on. Take a look at your eyes. Make sure those white, beautiful things that surround that beautiful coloration are okay. By the way, take a look at the iris itself, that little colorful piece right in the middle of your eyes. It should be a solid color. But if you see dark striations, if you see punctate white areas all the way around it, that's also suggestive that there could be problems. And the stress levels are affecting your entire system. That's an area called iridology, and it was started in Germany many, many, many years ago, but that's how they diagnose things. So you start putting together and you look at all the pieces of the puzzle. You look at the outer area. Your ear is an upside down person. The spine is right in through this area here. Okay, the organ systems are right in through here. The head comes down just above the earlobe itself. So if you start seeing different pieces, visualize that. Go online, check it out. It's called homunculus presentation in the ear. Homunculus, H-U-M, homunculus. See what you see. Go into the images. It's kind of cool stuff. Send me a note. I'll put it together for you. I'll tell you what needs to be done. But little things like taking the right types of CoQ10, making sure that you're getting enough C and B complex. Why B complex? What's important with B complex? Did you know that 500 milligrams of niacin will cause that burning and tingling sensation that you get? It lasts for about 10, 15 minutes. It's no big deal. It's annoying. But if you take it on an empty stomach, that's what happens. And if you combine it with niacinamide, they're both B3, by the way. They're just different forms. One opens up the tiny vessels in the capillaries. That's the niacin that we're normally, and the other one is niacinamide, and that opens up the pathway just before it. But the interesting thing, it works with liver function to dramatically drop your cholesterols. Now, you add that to a diet that decreases the inflammatory levels. That means something like a Mediterranean diet. Sometimes you want to do a keto diet. Keto diet is not bad as long as it's clean. As long as you're getting good free-range, organic, grass-fed beef. No pork, by the way, filthiest animal on the planet. I'm sorry for those of you who like your pork chops and all those things. Listen, I'm Sicilian. I grew up on that animal until I found out how bad it was. But if you eat pork or if you eat foods that are not cooked, like chicken or fish or pork, not so much beef, but if it's free range, it's not if you're going to get a parasite, it's when you're going to get a parasite. And guess where they can go? In the heart, as far as causing more damage. So understand that. So putting all the pieces of the puzzle together, you can be in control. Don't panic. Don't say, oh my God, what am I going to do? Well, there's a lot that you can do. And that's why we do Ageless Health live stream, to give you information. And we're going to get more and more data and give you more and more information, both on Dr. Tom Roselle Live, and we'd like you to join us there. And by the way, to find any of our teaching stuff, go to drtomroselle.com. And you'll find the past podcasts, you'll find our past live streams. They're all there. Join me. And send me questions. And by the way, there's a great Ageless Health shop there. Go in and check it out. These are people that we vetted. We know that the products work really, really well. So check it out. If you have a question, send me a note. I will get back to you. I promise. And we're going to be doing this ongoing. And we're going to start doing more information. We're going to create a newsletter that you're going to enjoy as well. Have a lot of things planned. And it's just, we're going to launch them and we're going to tell you what you can do to save yourself. And that's what this program's all about. Listen, I do this ongoing, and for one reason only, is that you really deserve to have this information at your fingertips. You need to be your own advocate. You need to be in a place where you can choose your health. It's called medical freedom. It's called choice. Don't let anybody take that away from you, but you have to be educated to know your options and what you can do. And that's why I do what I do. And remember one thing, I'm here constantly for one reason only. I love you all. You have an amazing day.